recently completed 25 sessions of radiation treatment with 50 uh, 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 grads. I think that's uh, rads, cumulative dosage of colorectal tumor. There are some side effects like painful to pass stool, some prostate, um, pain also while burning, while urination, not well hydrated. So these are negative effects of radiation on other tissue. Now, the positive of doing radiation therapy is that where it's going to hit in the distinct dosage is going to cause cell death. And that's what we want. We want cell death of the cancer, but where it's going to be diffused, it's going to cause cell damage. And when there's cell damage, then you end up with side effects of that cell damage. So you want to do everything you can to try to heal those cells. And so what do you do? So is it just a matter of trying to use detox protocols to detox the radiation? Well, I think that is necessary and you should do that, but you have to support the cells that were damaged. So if so that goes cell line by cell line. So in this case, how do you support cells that were damaged in the intestinal tract without supporting growth of cells in the intestinal tract? I would say using products that you would use to help heal the gut that have low amounts of glutamine in it. Things like, okay, so let me just pull something up here for you so it'll help understand this a little bit. So like our Clear GI product. Our Clear GI product is the reason why I like that product is because it has, I'm going to pull it up here so you can see it. So it does have glutamine in it, but it has 1.5 grams of glutamine. This is per tablespoon, and I tell people with cancer that are taking this because they need to heal their gut to only do a teaspoon at a time. So you're only getting 500 milligrams of glutamine, which is an acceptable dose of glutamine. But it has these other things. You can find other products on the market. Matter of fact, you might have some in your cupboard that have some of these other things. Modified citrus pectin, right there, can be helpful to bind radiation, but it can also be helpful to help heal the gut. Deglycerized licorice. So deglycerized licorice can be very healing to the gut. Many products you can find on the market that just have deglycerized licorice, DGL, it's abbreviated. That is very healing to the gut. Aloe vera extract is very healing to the gut. Slippery elm, marshmallow, chamomile, okra, cat's claw. Well, cat's claw is helpful for any bacteria in the gut. MSM is an anti-inflammatory for the gut. Quercetin, an anti-inflammatory for the gut. So those are the things that you would think about taking for the gut if you don't use this product. You might have another product that has these things in. I just thought of this when this question was asked, so I pulled it up. So also, this person said they're having issues with prostate. So then you think of prostate products that are going to help. So using the Prostate Supreme or our ProstaClear product would be great things to do. You need to support the systems that are damaged. So if you had, radiation to the chest with breast cancer and you're having lung issues, then you think of cordyceps, you think of our clear lung product, things that are going to help detoxify the lungs themselves, help heal the lung tissue themselves. So depending on what organ or what tissue is damaged, that's what you'd go after as from a nutritional perspective to try to heal that. In general, what do you recommend to heal the body? Any non-cancer cells affected with this type of treatment? So I explained that. I understand high dose vitamin C also helps. Some people suggest that raw vegan food may not be good after such treatment. Well, this is what we've talked about before multiple times. You hear about this so often, like every cancer patient should go on a raw food diet. Every cancer patient should start juicing raw vegetables and start just drinking that. That's going to cure you. This is not true. These are just statements that maybe that would be great. A raw food diet might be great if you're 22 years old, but if you're 44 years old, raw food diet are really difficult to digest. If you have the radiation in the colon area and you have a history of colon cancer, therefore the radiation, a raw food diet is going to be even more difficult because you already have compromise to the colon. It's going to be more irritating. And yeah, so I would not suggest a raw diet or juice eat or anything like that. Cooked vegetables are the way to go. I've talked about this before. When people have really damaged guts, they go on what's called a GAPS diet, where you're just basically making soup and cooking it all day long. So it's already very pre-digested and easy to break down for your gut. And you're drinking the broth of the soup. So you're vegetable broth and some of the meat broth that can be you make a chicken soup or something. That is the mildest on the gut, and that is really helpful to start healing. So I would suggest radiation to the colon, raw food diet, absolutely not. A very cooked food diet, a GAPS type diet, a soup type diet would be the best thing for a period of time to help that heal. So yeah, I would not suggest that. I think that would be more irritating, harder to heal, cause more problems.